Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. How mental health conditions are treated with brain stimulation therapy. Research team from University of Minnesota Medical School developed a preclinical model of a human brain stimulation therapy and found this therapy works by enhancing the brain's ability to process conflicting pieces of evidence, thus improving human cognition by making people more flexible in their decision making. The findings are published in Science Translation Medicine. Brain stimulation therapy is a treatment where electrical signals are used to stimulate specific parts of the brain. Urgent need for diet improvement during and after pregnancy, researchers. New research from the University of Massachusetts Amherst finds a pervasive low-quality diet among pregnant and postpartum individuals, reflecting an urgent need for widespread improvement. The study, recently published in the American Journal of Clinical Nutrition, assessed diet quality in the same individuals from the beginning of pregnancy through 1 year of postpartum. Researchers used the USDA's Healthy Eating Index, which is based on federal dietary guidelines, to develop a diet quality score for participants in the Pregnancy Eating Attributes study. The overall average Healthy Eating Index score for the study participants' diets was ranked on a scale of 0 to 100 at 61.6. On a traditional AF scale, the grade would be barely passing, a D, although that score is 10% higher than the average Healthy Eating Index score of the overall US adult population. The Healthy Eating Index score is based on the adequate consumption of 9 foods: total fruit, whole fruit, total vegetables, greens and beans, whole grains, dairy, total protein, seafood, plant proteins as well as fatty acids, and the consumption of 4 foods in moderation: refined grains, sodium, added sugars and saturated fats. Can music reduce distress in advanced dementia care? A new study published in the journal Nature Mental Health reveals the different benefits of music therapy, identifies mechanism to explain why music can have these effects, and provides a blueprint for implementing effective music therapy for people with advanced dementia. The research shows that if music therapy is designed to individual needs, it can deliver an immediate short-term reduction in agitation and anxiety for individuals with advanced dementia and improvements in attention, engagement, alertness and mood. Musical interactions can help people feel safer and more oriented in their surroundings, which can lower levels of distress and improve well-being. Study reveals protocol for assessing lung health in preterm infants. Existing methods to evaluate lung function in premature infants, such as spirometry, are limited by the need to perform forced exhalations, while impulse oscillometry, a non-invasive alternative, permits the measurements of lung respiratory mechanics without requiring forced expiration. There has been no report of an effective multicenter study design utilizing impulse oscillometry to assess the lung function in LGANs. A recent study led by researchers from the Department of Pediatrics at Children's Hospital of Philadelphia, USA, and published in Pediatric Investigation sheds important light on the suitability of impulse oscillometry for testing lung function in a large multicenter LGAN population. Despite the non-invasive nature of iOS, it has not been widely utilized to evaluate lung health in the LGAN population. This motivated us to report our methods and success in implementing a multi-center protocol for obtaining research quality oscillometry data in extremely preterm children, explains Dr. Catherine Tsukahara, the lead author of the study. In their study, the researchers recruited early school-age preterm children with a high risk of BPD from hydrocortisone for bronchopulmonary dysplasia respiratory and developmental outcome study, along with preterm children with minimal BPD or no lung disease from the transfusion of premature early school-age follow-up study. Additionally, full-term children with healthy lungs were utilized to enable effective comparison across different study groups. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.